Thanks for staying with us here on The Real Story. August 31st, International Overdose Awareness Day, but there are multiple overdose deaths every day on average here in Connecticut. So what's working? What are the conversations and priorities moving forward? Here with me to talk all about it, State Senator Saud Anwar. Thank you so much for being here.
Thank you for having me.
So as I said, you have a powerful perspective here. You are a state senator, part of the General Assembly. You know, you chair the Public Health Committee, but you're also a doctor yourself. You've spearheaded much of the state's response to the opioid epidemic, drug addiction needs, spreading Narcan, most of all because, you know, of all these roles, you've spoken to a lot of people who have been in the throes of addiction, who have recovered, people who have lost loved ones. What have you learned from them, especially around how we talk about addiction?
This is one of the most important questions. And then by the end of the day today, 4 more people would have died.
Wow.
And these are, each and every one of the deaths are preventable deaths.
Yeah.
I think if there was one single thing we can do better as a state, is the stigma.
Okay.
The stigma is actually part of the problem. Now, I know we have done a very good job in trying to get Narcan over to people. Right. Narcan saves lives. Whenever anybody uses it who has had an overdose, that's going to protect them at that time. But having said that, the reality is majority of the people who are dying from overdose, they're dying alone. And they're alone because they don't have a support system. And they don't have they have an internal stigma, there's an external stigma in our society. And that's something that we have to address.
And so coming off of that, you've been in public office for quite a while now on a community level and now obviously on a state level. From what you've seen, what has Connecticut done that has worked? Is there anything that sticks out to you? And then I know you mentioned stigma, but is there anything else that you really think the state should be focusing on to do better?
Absolutely. So there are a number of things. First of all, we have to make sure that enough availability of Narcan is there across the state.
Right.
Harm reduction is a very important part. Harm reduction centers in the communities that are functioning, they are allowing people to get needle exchange, syringe exchange, but also they're giving them the opportunity to get as much Narcan as they need, right, but also getting the fentanyl test strips. These are all important aspects to try and have a better identification of the risk, but also managing that risk. Having said that, we also have been able to put money into the treatment. Having methadone treatment or other treatments that are there and then medical assistance treatment, that is all helping the people who are ready for rehabilitation. So these are effective ways, but we have a lot of more work to do.
You brought up harm reduction centers. You know, we know that sometimes a controversial topic. They can be a tough sell for people in certain communities. We have seen a lot of states with them that tend to go through pushback, even though, you know, we've seen from statistics and from people that they do work. There's a lot of times the statement from people that they feel like harm reduction centers are encouraging drug use. What's your response to that? What would you say to people who maybe aren't so sure about them and think that, you know, they might not be the best fit? What have you seen from what they are doing for the community?
Sure, and this is part of the stigma that I was talking about, but the reality is that data shows that they are not increasing the usage. It is only giving the people an opportunity to be able to be in a safer environment. And so it's not a source of spread, it's a source of getting the people safer and helping them get closer to getting rehabilitation. Right. So one of the biggest challenges is people are experiencing loneliness. And they're becoming refugees from their own family, their own workplace, from their friends. And if there's a safe space for them that gives them the opportunity to get acceptance, but also gets them closer to accepting treatment and rehabilitation.
On a legislative level here, you know, obviously overdoses, close calls, drug use, we're seeing the statistics are getting worse and worse. And there's definitely a consensus, as you've been saying, that, you know, we need to do more, and you've been leading these discussions, drafting proposals. We, you know, just marking Overdose Awareness Day, you know, a couple months from the next legislative session starting next January. What do you want to see reprioritized? Are there any measures that you think need to be brought up again or reintroduced once you all join back together at the Capitol?
One of the things that we need to have a very robust conversation as a community, as a state, is this safe consumption sites.
Right.
The safe injection sites. These are actually proven to be effective.
Right.
Other parts, in parts of Europe, they've had them for 40 years. In Vancouver, they've had it over 20 years.
Wow.
And they have saved thousands of lives. And in New York as well, now there's a safe consumption site, which is actually saving a lot of lives every single day. We will have to have serious conversation around this topic, because if we really want to save lives, this is the way to do it. You have to be alive to get rehabilitation.
Right. And, we know too, a person doesn't necessarily have to be addicted to overdose. You mentioned at centers having the fentanyl test strips. We know testing is a really important part of this, as we are seeing a lot of these drugs be laced now. And so sometimes it might just be someone's first or even just second use of a drug when they overdose. As a doctor and a lawmaker, what do we do with that? I know there's been a bigger push to make more drug testing available.
So this is one of the biggest threats. There is no room for experimentation. You have a very long-acting, a very potent drug that is being illegally brought in and is being used,
Right.
and one use and person is dead.
Right.
And I've actually been able to hold and cry the families who have lost their loved ones who were just taking a pain medicine because of pain that they were going through. And that's why it's
Right.
important to recognize that what's on the streets, what's out there is very dangerous. It can be life-threatening, if not life-taking right away for that individual. So there's a law enforcement part that is actually very robust, and that needs to be strengthened further. But there's an educational opportunity for individuals to be aware of that what's out there is very dangerous, even if it's mixed with cannabis or any other drugs or pills that are out there.
And you mentioned about, speaking with those families who have lost loved ones. I know all the legislators we have on the show, they tell us that really informs the decisions that you all are making at the state capitol, is hearing those stories from constituents, from residents. Is there anything in particular that you've learned from them that they've brought to you as points they want you to focus on?
Yes. One of the things is we need to understand that the person is not making a choice to be addicted. It is a disease. And for the society to know that this is not a choice somebody has made, it is a disease. If we start to treat it as like a disease and start to identify what led to it,
Right.
start to address those aspects, and then have the empathy, kindness, love to be able to accept those individuals, give them a reason to live, and take away the pain, we will be in far better place.
Yeah, and when it comes to the opioid epidemic, last Overdose Awareness Day, we had someone on Real Story who had been addicted herself and unfortunately lost her husband to an opioid overdose. We were talking about the legal settlements and the money that you've been able to help distribute to community efforts as well as new ideas. We had asked her, was that enough, or what the Sacklers, Big Pharma, the health industry as a whole could really do to ever fix this? And her answer was nothing. She said there was nothing they could do to make amends, but every penny made could at least go to services. You're in the health industry and on the prescriber side, and you've now been a part of making those amends. Tell me about what that experience has been like for you.
It's when you are sitting with a family and a patient who has just died,
Yeah.
and you're crying with them, you feel helpless. And as a legislator, you feel that you can do more. So this sort of is a way for that pain that we are all experiencing in the healthcare world, are able to look at what can we do as a policy end. So that's where there's an opportunity. So I go with all the pain that the families and I am suffering with because of the pain of the people I've taken care of, as a way of solving the problem and not resting. Because, like I said initially, every child, every individual, every adult, these are preventable deaths.
And where has some of this settlement money gone to?
This is going to the communities. The settlement is along with the laws that were put in place based on the settlement agreement. That settlement agreement requires the funding to go through towns as well.
Gotcha.
So the towns are getting the money, and the towns have that opportunity to decide how they use it. But I do think that there's an opportunity not only on the prevention side. I've seen a lot of heavy effort on the prevention side, which is reasonable, but we have to start the treatment plans. We have to have support systems for the already hurting number of places that can give rehabilitation. So we have to provide it over there as well.
Yeah. And have you heard anything so far? I know, as I said, it's still, a little bit of a ways away until the next legislative session, but I feel like everyone's always, in that mindset. What have you heard from fellow lawmakers? obviously last year or this past session, this year was a short one. Next year is a budget session again, but a longer session. Do you feel like you'll have bipartisan and wide support for some of these proposals and ideas?
Yes. So look, the drugs do not differentiate who's who.
Right.
And the people who are dying, they're Democrats, Republicans, or unaffiliated.
Right.
The reality is the solutions are going to be bipartisan. Then we will do whatever it takes to pass these laws which are going to help save lives. That's what we have been doing in the Public Health Committee. Most of our laws, we've been able to work together and find ways to help the people. And we'll continue to do that.
And in our last minute here, we were talking about Overdose Awareness Day, the timing of this. You started out telling me a little bit about changing that stigma. Is there anything that you hope can be done in these conversations, whether it's on a community level or even at the dinner table? What do you want people to know?
Sure. I think the first thing is the stigma that is on the inside a person is experiencing who are experiencing drug use. Right. They feel that they have failed. I want people to know that this is a disease. And we are there for you. You are not going to be alone. We are going through every opportunity to help them. We want them to know that they are valued, they're loved, they're cared for. And at the level of the community, we want to make sure that the community recognizes that we have a responsibility to accept people, meet them where they are. And once we are able to meet them where they are, we have an opportunity to bring them to a better and a safer place.
Well, Senator, thank you so much, as always, for taking the time. We really appreciate you being here.
Thank you for having me. Thank you.
Of course, we know across the state and in every community, there are so many services, initiatives that can meet you wherever you're at, whenever you need. You can call 211 or go on the state website to find support of all types, from treatment to support groups, Narcan, and more. That does it for us now on The Real Story. If you want to watch these segments again, you can head to fox61.com or download the free Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61 or streaming on Fox 61 Plus. Have a great morning.